today's topic is regulation of respiration and the oxygen dissociation curves. Okay, so first of all, we would know what is respiration. Respiration is nothing but a physiological process that includes the external respiration and the internal respiration. So what do you mean by external respiration? External respiration is nothing but the you involve your breathing, or the gases molecules interact with the environment outside, exhaling and inhaling, nothing but simply called as breathing. Internal respiration is nothing but it involves the internal environment, your lungs and the capillaries. Okay, that's what we call it as an internal environment, or the exchange of gases in between the lungs and the capillaries. So respiratory quotient is one of the concepts that we are going to study here. Why are we going to study about the respiratory quotient? Is because it tells us about the health of the person. So how does it going to help us in knowing the health of the person is nothing but, see, that is going to give us actual knowledge about how the person's body is going to metabolize. What is it metabolizing? See, for example, carbohydrates, when it is metabolizing, it is going to give us the respiratory quotient as the 1. Okay, when it is giving the proteins quotient, it is nothing but 0.8, and fats, when it is there, then it is 0.7. So the formula is here to calculate the respiratory quotient is the amount of carbon dioxide produced divided the amount of the oxygen utilized, so which is there here. Okay, so that gives us actually value of how to analyze it, whether what is being metabolized in the person's body. For example, if a diabetic patient, if it is there, so that person's in his body, the respiratory quotient would be 0.7. That is because the fat is getting metabolized instead of the glucose molecules or the carbohydrates. That is because the insulin production is very low. If the insulin production is not happening, then the glucose molecules couldn't be broken down, or the carbon dioxide is not being, carbohydrates is not being broken down. Henceforth, the fat starts metabolizing in him or her. Okay, so that's how it gives us the health of the person, how well a person's health is. Okay, so here is the feedback circuit involving the respiration regulation. I'll show you the picture of the brain. So the brain, pons and the medulla is going to give us the centers of the respiration, which is going to release an acetylcholine, giving us the giving the signals to the lungs or the intercostal muscles to expand or the relax. Okay, that's how it is. I'll show you in the this particular diagram or this particular flowchart, wherein we could know that if the thoracic cavity increases or inspiration need to be occurs. Okay, if that has to happen, what would be the condition of the blood or the carbohydrates, carbon dioxide in the blood? That is, there is a decrease in the carbon dioxide in the blood. Henceforth, it is being urged to get the thoracic cavity being increased, and the inspiration is need to be occurring, isn't it? So if the decrease in the carbon dioxide levels in the blood, which is going to give the pressure on the receptors, henceforth that is going to release the brain is going to release the acetylcholine, which is resulting in the diaphragm or the intercostal muscles to get relaxed. Okay, so here the carbon dioxide is increased in the blood, which is going to if it is more in the blood, then it obviously gives the signals to the medulla oblongata to tell that the expiration need to occur or the inspiration need to occur, so that there is lots of oxygen molecules need to come inside our body. Okay, if there is more carbon dioxide levels in the blood, then obviously our body tends to increase the oxygen molecules. So how do you get the oxygen molecules? By inspiring. So inspiration need to occur. So that's why the diaphragm of the intercostal muscles gets contracted, so that the carbon dioxide is released out and the oxygen can enter inside. Okay, so that ultimately gives us the decrease in the carbon dioxide levels in the blood, which will give in turn the pressure on the receptors in the alveoli, which again the acetylcholine is released by the brain, which results in the relaxations of the contractile muscles. Once there is a relaxation, then the thoracic cavity decreases and the expiration occurs again. Okay, so this is in again round and round process. When the carbon dioxide levels is more, then obviously they tends to release it out and get take in the oxygen molecules. If the carbon dioxide is less in the blood, then obviously it is trying to get the to get back its own levels of the equilibrium of the gases in the molecule in the bloodstream. Okay, so that's how the round and round process is going to occur. Okay, so here the main center of the inspiration area is the medulla oblongata, which is going to control the expiration and the inspiration of the respiration, or nothing but the contraction and the relaxation of the intercostal muscles, nothing but. So here is the oxygen dissociation curves, which shows us how exactly the equilibrium of the oxyhemoglobin and the non-bounded hemoglobin at the various partial levels. Okay, actually the dissociation curve is nothing but when the partial pressure of the oxygen is like in the region of the alveoli, the hemoglobin molecules bind with the large amounts of oxygen molecule binds to form oxyhemoglobin and forms the oxyhemoglobin. The hemoglobin becomes fully saturated. So that's how there is a formation of S-shaped or the sigmoid graph is being formed. Okay, once you plot the graph, you would come to know how that is being formed. And moreover, the sigmoid shaped or S-shaped graph, you are very familiar because you have been studying from your childhood. Correct? From 9th and 10th also you had the sigmoid graph or S-shaped graph, which shows us how the regulation would take place, or how much of carbon dioxide or the oxygen is being entering inside our body. So there is another the process is going to happen, that is nothing but the cooperative binding. What do you mean by cooperative binding? It just simply means that one first oxygen molecule increases the affinity of the hemoglobin for the oxygen, making it easier for the next oxygen molecule to bind it. Okay, because there is the cooperative binding of the oxygen molecules is 4 polypeptide chains. So 4 molecules of oxygen need to be bound to the hemoglobin molecule. So the first one is going to make the way to other oxygen molecules to bind faster. Okay, it gives the way to the binding. That is nothing but the cooperative binding. So here is a graph which shows us the partial pressure of the hemoglobin which is binding and the percentage of the oxyhemoglobin saturation. So how exactly that is happening? This is the amount of oxygen unloaded to the tissues, and this area will say as the oxygen content of the mole of oxygen per 100 ml of the blood. Okay, so actually this can be explained very clearly in the next graph. This is the normal graph which we will be studying. Internally, how exactly we would know what areas that are is, see, this shows us the low moderate exercise. When the exercise is very moderate, the 50% of oxygen dissociation forms hemoglobin to supply the oxygen to supply to the tissues. Okay, so if this is the case wherein increased binding affinity when the few oxygen bonds and a low partial pressure of the oxygen is happening. This is in case of the lungs. Okay, so you could very clearly see that the veins and the arteries or the tissues, which is nothing but how exactly there is a graph which is being tilted upwards. That means it is trying to unload it to the tissues. The amount of oxygen which is unloaded to the tissues, which is in need of the oxygen molecules. That is what indicates the sigmoid graph or the S-shaped graph. Okay, so here is the graph which shows us the pH. See, there are certain factors which are affecting the graph, whether the graph can be tilted towards the left side or graph is getting tilted to the right side. So what is that making the graph to tilt, or S-shaped curve to tilt towards the left hand side or towards the right hand side of the graph? Why is that happening? So that is happening only during see, if it has to move towards the towards the left hand side, or if you can say it is right hand side of the graph, then increase in the in exercising tissues. So if you are giving lots of exercises to your tissues, then obviously the graph is moving towards the right hand side of the graph, which is telling us that there is more of oxygen saturation which is happening and reaching 100% saturation. Okay, with little of partial pressure of the oxygen only, the saturation is getting more increased. Okay, so saturation levels are increasing in case of the exercising tissues, and the normal pH blood level, it is normal only. Okay, so this clearly tells us how exactly the factors are going to affect in the shifting of the graph or the curve. Okay, so here the right hand side of the graph or the right side shifting is happening when there is increase in the oxygen affinity, decrease in the oxygen releasing. Okay, so oxygen gets released, decrease in the releasing of the oxygen, and increase in the affinity of the oxygen, which is one of the factor which is pulling the graph the other side, meaning it is in the urge of the oxygen, meaning the saturation is happening very rapidly. Okay, so the decrease in the partial pressure of carbon dioxide, decrease in the ionic concentration will also help in the shifting of the graph. In decrease in the concentration or the ionic concentration will pull the graph this side because it is being urged to get saturated very fast. The decrease in the temperature, colder times, you would you would feel that you would breathe more because there will be exothermic reactions been occurring. When the reactions are happening, you would breathe more. Okay, so so if the exothermic reaction need to occur, that means your body need to produce heat because of the temperature which is there decreased, or the lower temperatures, then obviously the curves get shifted towards the right hand side. Then the decrease in the DPG of the hemoglobin, which is making again 2,3 di of it's a molecule of here the DPG is nothing but diphosphate glycerate, which is making, if it is in decreased, again the concentration is, again the shifting of the graph is taking place. So what is happening, the reverse things are happening in case of the graph shifting towards the left hand side of the graph. Okay, so what is happening, the decrease in the affinity of the oxygen, increase in the release of the oxygen molecule. So when it is tending to release only, the affinity decreases, obviously that is, and then the increase in the partial pressure of carbon dioxide, and increase in the ionic concentration, increase in the temperature, and increase in the 2,3 diphosphate glycerate, again it is going to result in shifting the graph towards the left hand side. Okay, this is what are the shifting or the factors that is affecting the normal graph to tilt towards left or the right hand side. Depending on the situations and the conditions, it is going to shift. So the next is the the factor which is affecting is pH, the concentration which we told, isn't it? So what is that concentration which is making or pulling the graph towards right hand side? So the graph or the pH, we told, yes, it's a ionic concentration, but at what levels we didn't discuss. So here in detail we will be explaining how exactly the at what pH you would find that the shifting of the graph is taking place. Here this pH is 7.8, meaning more basic in nature, or nothing but the alkalosis or hypocapnia, which is happening, which is making the graph shift towards the right hand side. Normal graph is formed when the pH is very normal, that is 7.4, slightly basic. So when the pH is very neutral, that is acidosis, is going to nothing but the capnia is going to happen. Acidosis is not actually acidic, but it is neutral. But for our blood, it is acidic. Okay, so normal because it is 7.4, slightly basic in nature. Fine. So ultimately we can say that there is in the the acidic conditions, the hemoglobin releases the oxygen very readily. That is what we can come to a conclusion by seeing this particular graph. Meaning it is going to, oxygen is very much tendency to lose the oxygen or release the oxygen molecules. Next is the temperature graph. Here is the effects of the temperature which is being shown, where the graph is just tilting towards the right hand side, and this could be a normal one, or in between we could say between 20 degree and 30 degrees Celsius. You would find that at 10 degrees it is completely got shifted towards right hand side, and 43 degrees Celsius it is completely got shifted towards the left hand side. Okay, this is actually telling us the affinity of the hemoglobin to the oxygen is decreasing. Okay, so the affinity of the oxygen towards the hemoglobin or binding to the hemoglobin is getting reduced because of the degree temperature. Increasing the temperature, it is showing us that there is a decrease in the affinity of the oxygen to the hemoglobin molecule. Okay, so here is next is the partial pressure of the oxygen, or the this is the partial pressure, and here is the saturation. Of course the graph is same, but this is the graph to show us how it is different for the different organisms. Lukewarm, definitely they will be in the lower conditions, henceforth the graph is completely got tilted towards the right hand side. Ducks, insects, shore and all is their partial pressures is like this. Theirs is completely got shifted towards the left hand side, and you could see the humans graph also. This is just to show us how the differences between the organisms and the shifting of the graphs is taking place. Okay, depending upon the habitat and the conditions or the situations which they are facing. Understood? Okay, so this is again a picture which shows us how the Bohr's effect is going to act on the Bohr's effect is going to act on the body or the on us. How exactly the Bohr's effect is occurring? So Bohr's effect is nothing but it says us that when the partial pressure of the carbon dioxide is high, the oxyhemoglobin releases the oxygen. This is called as Bohr's effect. So it is going to readily release the oxygen molecules when the carbon dioxide partial pressure is high. Okay, so the oxyhemoglobin starts releasing the oxygen molecules when the carbon dioxide levels are more in the blood. This is what is Bohr's effect. So the lower pressure of the carbon dioxide in the blood, which is shifting the graph towards the right hand side, meaning affinity towards the saturation of the oxygen molecules. The high the carbon dioxide the partial pressure of the carbon dioxide, it is shifting towards the left hand side, so that the the saturation levels is low comparatively higher of the partial pressure of the oxygen molecules when it is internally when it is plotted into the graph, which you can see it very clearly here. Okay, so the normal one is the normal graph which we have studied earlier also. So the next is the Hylian effect. At the same time, here we would find that the decrease in the partial pressure commonly observed in the systematic tissues. Okay, so what is happening? The increases the carbon dioxide content of the blood, which is showing as the left shift of the carbon dioxide dissociation curve. This phenomenon is known as the Hylian effect. So when the graph is shifting or tilting towards the left hand side, you will actually come to know that there is an Hylian effect has been coming to force. You would, when you plot the graph, you would come to know that there is a straight lines being formed, that is addition of the carbon dioxide loading into these tissues, and here the standardized carbon dioxide which is loaded. This at the high partial pressure you would find this particular graph. At the low partial pressure of the carbon oxygen, you would find that particular kind of a line. See, here is the line which is showing you the low partial pressure of the oxygen molecules, and this is the graph which is showing you the high partial pressure of the oxygen molecules. So so ultimately we can tell that the Hylian is slightly opposite to that of the Bohr's effect, than in that more oxygen from the hemoglobin is available for transport and less of the concentration of carbon dioxide is there. Then the oxygenation of blood in the lungs displaces the carbon dioxide from the hemoglobin, which increases the removed carbon dioxide content. This property of a hemoglobin or this property is called as a Hylian's effect, which has been occurring in the blood or in between the oxygen molecules and the carbon dioxide molecules. Okay, so wherein you would actually know how exactly it is slightly opposite to that of the Bohr's effect. Okay, when when you find that more of oxygen from the hemoglobin is available for transport and less concentration of carbon dioxide, then obviously the oxygenation of the blood in the lungs displaces the carbon dioxide from the hemoglobin, which is less and is removes the carbon dioxide. Okay, so next is the root effect. Root effect is it's an exclusive property of for fishes and all. When the hemoglobin, however, is studied and reported as a reduction in the oxygen carrying capacity with decrease in the pH in the mollusks hemocyanins, then we would find that root effect is slightly changing from the Bohr's effect. I have given both the graphs to show how exactly there is a slight difference between the root and the Bohr's. See, as it is stabilizing, it is still reducing the saturation, but the saturation levels are maintained here for the 100%. So slight difference between the root effect and the Bohr's effect that I would say. See, if I talk about the root effect, then I would clearly explain you with the with this particular graph, because this is a factor which is going to show us how exactly the body size is going to affect the graph or the sigmoid curve. Okay, so here is the loop worm, which is very small, tiny, wherein its graph is completely got shifted towards the right hand side, whereas the duck a little smaller one, and the adaptation is quite different, so it is quietly shifted towards the left hand side of the graph. And this insects and all, it is again shifted towards the left hand side of the graph. Human, you would see it is very stable, in between it is, and you would see the elephant, again it has got shifted towards the right hand side of the graph, which shows us how as the body size is varying, the shifting of the graphs also you would find it very easily, and this can be connected to the root effect also, wherein the fishes are best examples that you would give for the root effect. Okay, so on overall, you would know that the graphs shifting or the oxygen dissociation curve is shifting towards right or left depending on the concentrations of the pH or the concentration, ionic concentration or temperature. Depending on the various factors which is being changing, it is having a drastic effect on the body as well as the curves shifting. Curves is just showing us how exactly the body is functioning and what is happening into our body. Okay, so that's what is all about the oxygen dissociation curve today. So any doubts you can write it on a comment section. If you've understood and if you've liked the video, please like it and subscribe for it. So today's topic is all of this. It's over, and we'll be seeing you soon via the next topic. Okay, thank you.